Turning now to Tennessee, where doctors are being faced with a seemingly impossible decision. Who should receive monoclonal antibody treatment? New guidelines from the National Institute of Health and the Tennessee Department of Health recommend doctors prioritize unvaccinated patients for treatment due to their risk level. And as patients wait in long lines, doctors say supplies are running dangerously low, forcing them to turn away people who may desperately need treatment. NBC News correspondent Antonia Hilton joins us now from outside a medical clinic in Brentwood, Tennessee, with more on this. Antonia, good morning. So first, just give us a sense of how many people are using this treatment in Tennessee, how doctors are choosing who's going to get that antibody treatment, and kind of the backlash that it's receiving, given that it is those unvaccinated patients, as I mentioned.
Good morning, Savannah. Look, here, the demand is far outstripping the supply right now. At this clinic behind me right here, they're getting about 50 requests, new requests a day to get access to these infusions. But they only have about 50 doses left for this entire week. And when we've spoken to providers all around the area here in Nashville, that's consistently what we've heard, that they have waiting lines for people who want to get infusions. And look, you know, this is increasingly complicated with these new guidelines from the NIH, from the Department of Health here, because previously providers weren't really considering vaccination status. They were just looking at who's the sickest coming through the doors, who may have health complications and really need these infusions to stay out of the hospital. And so this clinic here is saying, frankly, they're going to ignore that guidance, that they don't want to worry about vaccination as they decide who gets the very few doses they have left on hand, while hospitals down the road are saying, no, this makes sense. We have to prioritize the unvaccinated in a state like Tennessee, where so many people are still hesitant. And when you're unvaccinated, you are 11 times more likely to end up hospitalized here. So, you know, it has certainly become a really tense challenge here, and it is a day-to-day thing as providers scramble to come up with what's going to be their game plan as supplies are diminishing. Savannah?
Antonia, you mentioned specifically some of the issues that particular state, that Tennessee, is facing. Tell us, has this become a political issue there? And are doctors recommending still the vaccine as the best way to protect against COVID, especially hearing that this treatment is going to people who haven't been vaccinated?
It's absolutely become political, and yes, the medical community here is still begging people to consider vaccination. Less than half of the population here is vaccinated in Tennessee, so they have a long, long way to go. And doctors worry that people will lean on these monoclonal antibody treatments and say, hey, as long as this is available, you know, I don't actually really need to get vaccinated. But as they're seeing the supplies of this diminish, they're begging people, you know, go get vaccinated. We can't guarantee that if you call us here at this clinic, we are going to have space for you. The administrator of this clinic behind me here told me that just the other day she was on the phone with a mom who's 32 years old, begging her to get her husband into the clinic, and she could hear the husband in the background struggling to breathe. But because of the lack of doses that she had and the guidelines that she had to follow, she just couldn't take this man, and that was heartbreaking for her. I want you to take a listen to a conversation that I had with a doctor down the road at Vanderbilt, Dr. Karen Block. She runs their infusion clinic there, and their team is deciding that they do have to go along with this guidance. So, you know, you can just see here how much this is a patchwork. Take a listen to Dr. Block.
It's a tough issue, and I think there is certainly a tension between people who feel like they've done the right thing and those who haven't. The way that I would explain it is really taking the politics out of it and really basing it on the science. And we know from the science that the folks who are going to get the sickest and who would benefit the most and who would be less likely to be hospitalized are those who are at highest risk. And I certainly would never suggest that somebody not get the vaccine, which is a really critical preventive measure. What the antibody is for really is for folks who break through and for folks who have symptomatic COVID. And so I think the messaging really should be that the vaccine is the first line of defense here.
I asked Dr. Block, you know, as you interact with these unvaccinated patients asking for these infusions, are you able to convert them into people interested in getting the vaccine? And she sort of hedged and said, you know, it has just been so challenging because of the political situation here in Tennessee. But doctors are trying their best to talk to patients face to face and get them to see the vaccine as the first line of defense. Savannah?
And you can absolutely imagine that tension that she described between people who feel like they did the right thing and they're needing that treatment. Antonia, I know you also spoke to several physicians about the confusion over these antibody treatments in general and how it's affecting their work. What more can you tell us about that?
It's the confusion and the complication here is a day-to-day challenge for them. I spoke to 2 physicians who run this clinic and other clinics around the Nashville area. And, they're really hurting because as politicians and the federal government figure out how these doses are going to be dispersed around the country, how much certain states, certain hospital systems are going to receive, when patients are upset and they're panicking, they're not calling their, local representatives. They're calling the doctors who work at locations like this one. So it's these emergency physicians, it's the nurses who work alongside them who are hearing people leave panicked voicemails, who are having people come by and beg them, ask why they're so far behind in the queue. And that just makes their work all the more painful after, of course, as we all know, a really difficult year for all of them on the front lines of this. Take a listen to my conversation with the 2 physicians who run this site here.
I think they're upset and frustrated that they can't provide the treatment that the patients need. That's, we're trying to do the best we can, and the providers are very involved in patients' care, and again, just kind of frustrated they're not able to do what they need to do for our patients.
It's definitely taking a toll on their morale at work, knowing that there's therapies out there that can really help keep people from going to the hospital and really make people well faster, and that we can't get them and administer of it. It's very frustrating for our staff, but more so for our patients. There's a lot of patients who are feeling very desperate.
They say that if they don't get more supply in just the next couple days, they may have to announce that they are no longer going to offer this treatment at all, which is just unbelievable. Savannah?
Yeah, Antonia Hilton, really powerful reporting. Thank you so much.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.